It is a painful problem most women will face at some point in their life. Fibroids are non-cancerous tumors in a woman's uterus. Up to 70% of women will develop them by the time they turn 50. They're not life-threatening, but they can be very painful and cause heavy bleeding. Traditionally, the solution is having a hysterectomy or removing the uterus. But as Amanda Brandeis explains, the Texas Institute for Robotic Surgery is changing that.
Part of me I didn't really want to know.
Didn't want to know why it felt like her body was turning against her.
It's not a good feeling as a woman thinking that there's parts of you that don't work the way you want them to work.
And for years, elementary school teacher Betty Whitney lived each day in pain.
I had good people to work for that were understanding, and sometimes, you know, you just do what you can to get through that moment.
She had fibroids, one the size of a fist. A doctor recommended removing her uterus, but Whitney wanted to find another way.
The foot pedals control.
Eventually finding Dr. Devin Garza.
Some women, regardless of childbearing, don't want to have a hysterectomy.
Dr. Garza is one of few surgeons trained on the Acessa, a less invasive procedure that uses radio frequency energy to shrink the tumors. But he's the first in the nation to use it on the robotic platform, allowing more precision and ease to remove fibroids.
It allows for less operative time, less blood loss, and if we can avoid more trauma to the uterus and shrink those fibroids and get the clinical results where a woman feels better, that's where everybody wins.
And while not every patient is a good candidate,
in a weird way, I don't look younger, but I feel younger.
Whitney was back on her feet within days after the procedure, without fear of the future. Amanda Brandeis, KXAN News.
Dr. Garza says women suffering from very large fibroids are often good candidates for this procedure. And to learn more about common symptoms of fibroids, find this story on KXANcom.